We're going to do a little décolleté rejuvenation with some Hyperdilute Radiesse for this beautiful patient of mine. So here I am. I'm just marking out some global guidelines. I don't follow them directly, but it kind of helps tailor my treatment to make sure that I'm hitting all areas of her décolleté. And I'm going to start with these 3 little chicken feet, and then I will blend accordingly based on how the Hyperdilute Radiesse is laying. So I already started with one side of her neck, and now we're going to work down on her décolleté. So I would start with a 32 gauge needle using a little lidocaine with epi and bicarb just to numb that little pilot hole that I'm about to create. I like to use a 25 by 2 inch cannula. If you have a little bit longer, even better, but the longest cannula we have in our office is the 25 by 2 inch cannula, but it's a great cannula. I start off with that port needle to guide my cannula in, and now I'm working my way down into the tissue. You want a good amount of tissue overlying the cannula. You don't want to see the complete shape of the cannula. You want a little bit of dense tissue overlying it, but not too much that you're diving too deep. So I just make sure that my plane of injection is nice and parallel. I don't want my cannula bending or flexing at any point. And really, it should glide in like butter. You'll see that I don't really hit areas of resistance. The goal is to just blend that Hyperdilute Radiesse throughout the décolleté and let it kind of wash the décolleté. I often use that phrase, a décolleté wash, as the kind of title of my treatment, because that's essentially what we're doing. My dilution here is a 1:4 dilution. So that means 1 part Radiesse, 4 parts diluent. So remember, Radiesse comes as a 1.5 syringe, and then I mix in normal saline or sterile water. So 1:4 would be 6 cc's of normal saline or sterile water. I usually do maybe 5.5 of that diluent and then 0.5 of just plain lidocaine just for comfort. But really, my patient said she didn't feel anything for this entire treatment at all. She said it was incredibly tolerable and actually really wild that she didn't feel it considering the length of the cannula we were using. But it's a very, very tolerable treatment. So I use a 1:4 dilution, and I'm just blending that Radiesse throughout the décolleté to really let it work its magic. Remember, Radiesse helps stimulate collagen type 1, collagen type 3, and elastin. And the way it works is my medical science liaison gave me a beautiful kind of visual on how I process Radiesse. So if you think of collagen as the web and a fibroblast as a spider, in order for the spider to be functioning, it has to be attached to the web or collagen. But as we age, we lose that collagen, so the spiders have nothing to latch onto. So you have all of these free-floating fibroblasts, and the fibroblasts kind of work as the referees for our collagen stimulation. So you have all of these senescent fibroblasts, or these free-floating fibroblasts in our extracellular matrix that are doing nothing for our collagen stimulation process. So when we inject a single syringe of Radiesse, we have these calcium hydroxylapatite microspheres in it. And each one of these microspheres can reactivate 6 to 8 fibroblasts, or 6 to 8 little spiders essentially, and go on to reactivate these fibroblasts so they can then go on to stimulate collagen, elastin, proteoglycans, all of these delicious things we need for healthy, youthful, dewy skin. So all of these microspheres are in the syringe. There are over 30 million microspheres in a single syringe of Radiesse. So you are stimulating hundreds of millions of once inactive fibroblasts now are reactivated with a single syringe of Radiesse. So instant gratification is not there with this treatment. This treatment takes time to really see that skin thicken, that collagen thicken, and that skin just look healthier and dewier over time. So it's important to tell your patients that instant gratification is likely just that diluent that we mixed the product with, and we have to give it time to work its magic. We have to give it time for those fibroblasts to latch on to those microspheres and start stimulating collagen elastin so that we can reap the benefits of it. But our goal, like I said, is just to wash the radiesse through. I always have my patients do some gentle massaging with clean hands for a few days just to make sure that nothing kind of clumps together. It typically doesn't happen, but just to avoid it altogether. I will say at each of my port sites, I pinch that port site to make sure I had no accumulation of radiesse at that little port, because you can get a little what I call rice kernel nodule right there, and sometimes you'll have to subcise or flush that rice kernel. It's easy to fix, but it can avoid a follow-up appointment if need be. So I always pinch that little port site to make sure that I get all of that little accumulated radiesse out so that it doesn't form this little non-inflammatory nodule. But this treatment is absolutely beautiful. I love performing this treatment on patients once a year. I tell them I'll typically do a full syringe in their décolleté and then 2 in their neck, because we really see a lot of those aging changes in the neck. But I love this treatment. 3 syringes for the neck and décolleté, 1:4 ratio, and once a year, and they absolutely love it. If you're loving these videos, please help me reach my goal of 1,000 subscribers by the end of 2025 and hit that subscribe button. Comment below if you have any topics you want me to cover or any questions about anything and all things Hyperdilute Radiesse.